Today we're going to review one of the most fundamental topics in applied behavior analysis, continuous measurement. In ABA, we rely on objective data to evaluate behavior change. Continuous measurement refers to methods that record every instance of a behavior during an observation period. The main continuous measurement dimensions we'll cover today include frequency, rate, duration, latency, and interresponse time, or IRT. These measures form the foundation of database decision-making. Instead of guessing whether behavior is improving, we collect measurable data and analyze it to guide treatment decisions. This topic appears frequently on the BCBA exam, so understanding the differences between these measurement systems is critical. By the way, if you want to practice these concepts with realistic exam questions, you can check out our BCBA mock exam platform at www.bcbamockexam.com, where we provide full-length practice tests and measurement-focused scenarios. Let's start with why continuous measurement is so important in ABA practice. Continuous measurement allows us to track behavior change precisely. Because we record every occurrence of behavior, we obtain accurate and reliable data. That data then guides clinical decision-making. BCBAs use measurement data to determine whether an intervention is effective, needs modification, or should be discontinued. It also supports treatment evaluation. Without accurate measurement, we cannot determine whether behavior is improving, staying the same, or worsening. A good way to remember this is the ABA decision cycle. Behavior leads to data, and data leads to intervention decisions. For the exam, remember this principle. Good treatment decisions require accurate measurement. Now let's define continuous measurement more formally. Continuous measurement refers to a measurement system in which the observer records every instance of the target behavior during the entire observation period. In other words, the measurement captures the full occurrence of the behavior, not just a sample. Continuous measurement can capture several behavioral dimensions, including frequency, duration, latency, and interresponse time. A key feature is that continuous measurement does not rely on sampling procedures such as partial interval or momentary time sampling. Instead, every behavior event across the timeline is recorded. It's very important to distinguish continuous measurement from discontinuous measurement because the BCBA exam often tests this difference. Continuous measurement records every instance of behavior, which results in higher measurement accuracy. Discontinuous measurement, on the other hand, records behavior during selected time intervals rather than continuously. Examples include partial interval recording, whole interval recording, and momentary time sampling. Discontinuous systems are typically used when behaviors occur too frequently to record continuously. A common exam trap is confusing partial interval recording with continuous measurement. Remember, partial interval recording is a discontinuous sampling method, not continuous measurement. In applied behavior analysis, several common measures fall under continuous measurement. These include frequency, the number of times a behavior occurs; rate, frequency divided by time; duration, how long a behavior lasts; latency, the time between a stimulus and the beginning of a response; interresponse time, or IRT, the time between two consecutive responses. Each measure captures a different dimension of behavior, and selecting the correct measure depends on the characteristics of the behavior being studied. Let's start with frequency. Frequency refers to the count of the number of responses that occur during an observation period. This measure is most appropriate when behaviors are discrete, meaning they have a clear beginning and end. Frequency is often collected using simple tally recording systems. It is commonly used in skill acquisition programs, where therapists count how many correct responses occur during a session. For example, counting how many times a student raises their hand in class would be a frequency measure. A key exam tip is that frequency works best when responses have clear start and stop points. Let's look at some examples of behaviors measured using frequency. For instance, we might measure the number of requests a child makes during a session. We might count the number of hand raises in a classroom setting. Another example would be the number of aggressive incidents observed during an observation period. We could also measure the number of completed academic problems, such as math questions solved during a task. All of these examples involve behaviors that occur as separate, countable events, which makes them appropriate for frequency measurement. Next, we have rate. Rate is similar to frequency, but adds an important element, time. Rate is calculated by dividing the number of responses by the amount of observation time. In formula form, rate equals count divided by time. Rate is useful because it accounts for differences in session length. For example, if one session lasts 10 minutes and another lasts 30 minutes, simply comparing frequency counts would be misleading. By converting frequency into rate, we can compare behavior across sessions with different durations. Some common examples of rate include responses per minute or responses per hour. For example, we might measure words read per minute to assess reading fluency. Another example is problems solved per hour in an academic task. We could also measure requests per minute in a communication training program. A common exam trap occurs when students compare frequency across sessions of different lengths. In those cases, rate should be used instead of simple frequency. Duration measures the length of time that a behavior lasts. Instead of counting how many times a behavior occurs, we measure how long the behavior continues from onset to offset. Onset refers to the moment the behavior begins, and offset refers to when the behavior stops. Duration measurement is especially useful for continuous behaviors that extend over time. Examples include tantrums, engagement with tasks, or time spent exercising. Duration data can be recorded as total duration across a session or average duration per occurrence. Some practical examples of duration measurement include time spent on task during a learning activity. We might measure the length of a tantrum, starting when the tantrum begins and ending when it stops. Another example is time engaged with an activity, such as playing with toys or completing homework. Duration is particularly useful when behaviors vary in length, because counting occurrences alone would not accurately reflect behavior intensity. Latency measures the time between a stimulus or instruction and the initiation of a response. In other words, latency captures how long it takes for behavior to begin after a cue is presented. For example, if a teacher gives the instruction, "Start your homework," latency would be the time between the instruction and a student beginning the task. Latency measurement is commonly used in compliance training. It can also indicate prompt dependence, meaning a learner may delay responding until prompts are provided. Examples of latency include time to start homework after an instruction is given. Another example is the delay before answering a question during a classroom discussion. We could also measure the time it takes for a child to follow an instruction, such as "come here." It's important to remember an exam distinction here. Latency measures delay, not duration. Duration measures how long behavior lasts, while latency measures how long it takes to begin. Interresponse time, or IRT, refers to the time between two consecutive responses of the same behavior. Rather than measuring when behavior starts after a cue, IRT measures the spacing between responses. IRT is especially important when evaluating behavior rate and fluency. It is also used in differential reinforcement of low rates, or DRL procedures. In DRL interventions, longer interresponse times indicate that the rate of the behavior is decreasing. Examples of interresponse time include the time between questions asked during a conversation. We might also measure the spacing between bites of food during a meal. Another example is the time between interruptions during classroom discussion. When implementing DRL procedures, longer IRT values typically indicate that behavior is occurring less frequently. Another measurement dimension is percent of occurrence. This measure calculates the percentage of opportunities in which the behavior occurs. Percent of occurrence is commonly used in discrete trial training, where behaviors occur across clearly defined trials. For example, if a child correctly labels an object in 8 out of 10 trials, the percent occurrence would be 80%. An important exam tip is that percent calculations are based on trials or opportunities, not time. Trials to Criterion measures the number of trials required for a learner to reach a predetermined mastery level. For example, a program might define mastery as 90% correct across 2 consecutive sessions. Trials to Criterion tells us how efficiently the learner acquired the skill. Fewer trials indicate faster learning, while more trials suggest the teaching procedure may need modification. This measure is commonly used in skill acquisition programs. Selecting the correct measurement system depends on several factors. First, consider whether the behavior is discrete or continuous. Discrete behaviors with clear start and stop points are often measured using frequency or rate. Continuous behaviors that last over time are typically measured using duration or latency. Other considerations include observation time, clinical relevance, and the practicality of data collection. Ultimately, the measurement system should provide data that meaningfully informs treatment decisions. In ABA, measurement data are typically displayed using graphs. Frequency data often appear as count-based graphs, showing the number of responses. Rate data allow standardized comparisons across sessions. Duration data represent time spent engaged in behavior. Latency data represent the delay before a response begins. These graphical displays allow behavior analysts to visually analyze patterns and determine whether interventions are effective. Measurement questions appear in several forms on the BCBA exam. One common format involves scenario descriptions, where you must identify the appropriate measurement system. Another format involves measurement selection, where you choose which dimension best fits a behavior. You may also encounter data interpretation questions, where you analyze trends and data. Finally, you may be asked to interpret behavior graphs. These questions typically appear in multiple choice format, but may also involve interpreting written scenarios. There are several measurement concepts that students frequently confuse. One example is rate versus frequency. Frequency is simply the count of responses, while rate accounts for time. Another confusion is latency versus duration. Latency measures the delay before behavior begins, while duration measures how long behavior lasts. Students may also confuse interresponse time with latency. IRT measures time between responses, while latency measures time between instruction and response. Finally, percent occurrence should not be confused with frequency, because percent is calculated across opportunities or trials. Measurement plays a critical role in clinical decision-making. By collecting accurate behavior data, BCBAs can evaluate whether an intervention is effective. Measurement data help us track progress toward treatment goals. They also help identify whether behavior reduction procedures are working. Most importantly, data guide program modifications, ensuring that treatment remains effective and ethical. Measurement is also essential for evaluating treatment outcomes. Before intervention begins, we collect baseline data to establish the current level of behavior. During intervention, we monitor data to determine whether behavior is changing. After the intervention, we may evaluate generalization, meaning whether the behavior occurs across different environments. We also evaluate maintenance, which refers to whether behavior change persists over time. To summarize today's review, continuous measurement involves recording every instance of behavior, allowing us to capture the full occurrence of behavior. Different measurement systems capture different behavioral dimensions, including frequency, rate, duration, latency, and interresponse time. Accurate measurement supports data-based clinical decision-making and improves treatment effectiveness. Because measurement is foundational in ABA, it is also heavily tested on the BCBA exam. As you prepare for the BCBA exam, make sure you are comfortable distinguishing among these measurement systems and interpreting behavioral data. Practice identifying which measurement dimension best fits different behavioral scenarios. The more familiar you become with interpreting measurement data, the easier exam questions will become. If you want to test your knowledge with realistic BCBA-style questions, you can try a free full-length mock exam at www.bcbamockexam.com. It's designed specifically to help candidates strengthen their measurement skills, data interpretation, and exam confidence.